Dear students, I am myself Adarsh Kumar, lecturer from Faculty of Nursing from Rama University. Today, new topic. The topic name is hypertension. What is the meaning of hypertension? First, we will see simple anatomy of the heart. There are four chambers: right atrium, right ventricle, left ventricle. This is right part and this is left part. In here, this is impure blood part and this is pure blood part. In here, the whole body, from whole body to heart, the impure blood is come by the superior vena cava, This is right atrium, this is left atrium, this is right ventricle and this is left ventricle. Superior vena cava, through the whole blood is coming from the body to the heart, and now the pure blood, it means oxygenated blood, is out from the aorta into the whole body. In here, the circulation maintained by the heart. Heart is work, that is the pumping of the blood. First, we will see the definition of hypertension. What is the definition of hypertension? Here, the elevation of the pressure into the blood vessels, It means the increased pressure of the blood vessels wall, and the pressure normal blood pressure is 120 by 80 mm Hg. But in here, if the elevation is there, then the pressure is increased up to 150 by 90 mm Hg. It means when the blood vessels are narrowing, then the pressure is increased. The pressure, normal pressure is 120 by 80, and when they increase the blood pressure, now the increased pressure is 150 by 90. And here two things, but first is systolic pressure and one is diastolic pressure. It means systolic means upper pressure, like 120 is systolic and 80 is diastolic. In here, increase the pressure of the blood vessels, it means walls of the blood vessels or arteries, and the pressure is normal 120 by 80 mm Hg, and here when they increase the pressure, then the pressure is elevated 150 by 90 mm Hg. Here two pressure is showing, like first is systolic and second is diastolic. Systolic is 120, means upper rating, and diastolic is lower rating. Second, we will see the causes of hypertension. Causes of hypertension. What are the causes? First, systematic causes like kidney disease. Second is liver disease. Third is nervous stress like. There are three main. First is kidney disease, second is liver disease, and third is nervous system. Why? Because they are operating all the things. And some other causes like alcohol consume, alcohol over salt taking. If you are taking more salt, then the blood pressure will be increased. That they are the causes of hypertension. Next will we see the types of hypertension. There are types of hypertension. Hypertension. Stage first, hypertension, tension, or stage second, hypertension. In here, stage first, the BP will 140 to 80, and here 160 to 90. And here normal pressure, normal hypertension. नॉर्मल क्या है 120/80 mm Hg. These are the normal. So there are three types. First is normal. Normal is 120/80, and second is first stage hypertension is 140/80, and second stage is 160/90 hyper mmHg and above. In here it will increase some severe condition. Now we will see the sign and symptoms of what are the sign and symptoms of hypertension. What are the sign and symptoms? First is severe headache. Second is blurred vision. Third is nausea. Fourth is vomiting. Next is severe headache, blurred vision, nausea, vomiting. Here dizziness, fatigue, restlessness, severe chest pain. So there are so many sign and symptoms like severe headache, blurred vision, nausea, vomiting, dizziness, fatigue, restlessness, chest pain, and irregular heartbeat. Irregular heartbeat. In there, irregular heartbeat. Now we will see the diagnosis, how we will diagnose the hypertension. First we will check the BP, then we can find out the elevation of pressure. Second, some other like first is this is diagnosis. In here physical examination. Second is history collection or medical history. It means if they are having some disease condition in previous year, या previous time, like disease like related to liver or kidney, or if they are having diabetic mellitus, then it will happen. And here we can do CBC. It means complete bed count we can do in here, and we can do X-ray. Which part? Chest X-ray. Chest X-ray. And one more thing we can do in ECG. What is the meaning of ECG or full form of ECG? Electrocardiogram, and it will show the rhythm of the heart. So these are the diagnosis of the hypertension. What is? First is physical examination, second is history collection, and otherwise medical history. In here we can ask or we can check the reports like related to liver disease, kidney disease, and some other if they have in past time diabetic mellitus. And here we can also check at the time the CBC, it means complete blood count, and X-ray. In X-ray we can take the X-ray for the chest part. In here ECG we can do ECG, it means electrocardiogram, and it shows the regulation of the heartbeats. Now we will see the management of the hypertension. Management of the hypertension. What are the management we can do in here? First we can do the manage the dietary plan. What in here we can do? First, because I told in the causes, if you are taking increase amount of salt, then it will happen. So in here reduce the salt quantity. Next is reduce the or avoid the alcohol. In here we can avoid the alcohol, and some other things we can manage in dietary plan. And second is pharmacological management of. What are the pharmacological management in there we can give? In pharmacological management we can give vasodilators, alpha blockers, next beta blockers, next is calcium channel blockers, and ACE inhibitors. Next is diuretics we can give. So these are the medications we can give in here. In here I given only action like that. Okay. So we discussed regarding hypertension and what are the definition, causes, sign and symptoms. In hypertension, it is an elevation of the pressure into the blood vessels. In here some anatomy and physiology regarding heart. This is right atrium, this is left atrium, and this is right ventricle and left ventricle. This part is taking in pure bloods it means deoxygenated blood, and this part is taking oxygenated blood. This part taking from the whole body by the superior vena cava or inferior vena cava, and this will giving the whole body to by the aorta. This is the anatomy, and the heart function is pumping the blood and to the whole body. And here the definition is elevation of the pressure into the blood vessels or blood walls, blood vessels wall, and the causes of their like if they are having diabetic mellitus and liver disease, kidney disease, and if they are taking alcohol or they taking more salt, if then the hypertension will be happened. The types are, there are 2 or 3 types. First is normal hypertension is 120/80, then stage first is 140/60, 140/80, and the stage second is 160/190. This is the hypertension types. There are sign and symptoms. In here, sign and symptoms, first is severe headache, next blurred vision, next dizziness, nausea, vomiting, and irregular of heartbeat, chest pain, and fatigue. The diagnosis are we can give in here, or we can do like first is history collection and second is physical examination. In history collection we can check the last history, like if he have or she have diabetic mellitus, that it will be happen. And next is management, and in diagnosis other we can do the CBC, means complete blood count, and we can do the ECG and chest X-ray. In here, next is we will discuss regarding management. There are 2 management. First is dietary management and other. In dietary management, in other we can do first manage the concentration of the salt and alcohol avoid, and do the exercise proper, because if you are having obese condition, then it will happen. Next is management of medical management. In here we can give the diuretics, beta blockers, calcium channel blockers, alpha blockers, ACE inhibitors, and we can give the calcium channel blockers. These are the management, or these are the pharmacological management of the hypertension. So I hope you enjoyed with this topic. Very thank you.